Over the weekend, Ottawa County just moved into the substantial community risk category for COVID-19 transmission. And that is very significant and is a call to action, really, for all of us, for individuals as well as businesses, employers, faith-based organizations, schools. Every type of place needs to be thinking about what can we do right now while we have time to slow down the spread. It also means that there's a lot more COVID-19 in our community. We believe that most of the cases are the Delta variant. And if you look at what's happening around the US, you can see that from a low number of cases and what we thought was some victory and that we had this in control, we're seeing this precipitous increase in COVID-19 cases and positivity, hospitalization, and even deaths across the nation. That is due to a change, and that change is the Delta variant. This is more infectious. It possibly causes more severe disease. So our time to act is right now, and that requires all of us to evaluate what we can do to implement additional prevention measures that we maybe have relaxed just recently. For employers, as they consider this new information, they will want to be thinking about how they can keep their teams safe, their employees safe. So, that is a big consideration. A second consideration is if your employees become ill and there are close contacts, you could have an outbreak in your business, and that could compromise your ability to actually operate. So, there's a couple of things to be thinking about here, and they affect one another. So to keep your employees safe, I think we've all learned really well the prevention strategies that we used last year, but vaccination is going to be the strongest and most effective strategy that you can use. So do think about things that can encourage your employees to get vaccinated. Maybe hold a clinic at your facility, or give them a day off or maybe 2 days off to go get the vaccine. And then if they have reactions to it the day after, they don't need to come into work if they don't feel good. So be thinking about that. But also look at distancing again in your workplace. How can you get to that 6 feet of distance between customers and employees, or from one employee to another? Look at disinfection and hand washing, but also look at face masking. All of these prevention measures, they're not an all or nothing situation. So it's not like everyone has to put on masks all the time or no one does ever. There's a lot of intermediate steps that you can get creative with and think about and do. So, be looking at those and maybe try, an intermediate point and see how that works. And then you can scale it up or scale it down according to the community conditions. So just last week, the Michigan Department of Health and Human Services released an alert based on their random sampling of positive COVID-19 specimens and sequencing of them. And the number of results that were sequencing as the Delta variant caused them to conclude that the majority of cases currently circulating in Michigan are now the Delta variant. So we want everyone to understand that you should just assume that when you interact in the public, you are probably encountering the Delta variant in people. And as cases climb, that likelihood that you're going to be exposed to someone with this variant increases. So what does that mean for you? That means that everybody, now that we have entered the substantial risk category, and in days, considering the speed of increase, we could go into the high risk category. Everybody, regardless of vaccination status, needs to be masking when they're in public places. Even consider this if you're outdoors and it's crowded, you can't assure that you're going to be 6 feet or more away. Have a mask available, just for your kids, for yourself. Keep them around, keep them in your pocket so you can pop one on whenever you see the need. So, we were just talking about the fact that we hit the substantial risk category according to the CDC, but I want to make everyone aware that the growth of the incidence of the Delta variant is rapid. And every time I look at the CDC's COVID-19 tracker, it's like a red wave, a high alert level is moving across the US and toward the north and northeast. And so it could be just a matter of days by the time this airs, and we could already be in the high risk, which is the highest level of community transmission. So what does that mean for everybody? That means every employer, every policymaker needs to be really seriously looking at what they might need to put in place to protect the people around them, to protect their employees, to protect their business. There could be mandates rolling out from the state or local health authorities. So, be mindful of that. Take this seriously, please. This is different than where we were, and hopefully we will overcome this too, but this is where we are right now.